Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. Today we have a patient complaining of a rash on her cheeks and nose. The rash becomes worse when she's exposed to the sun. She's also complaining of fatigue and vague abdominal pain. She recalls starting a new medication recently, but she forgot the name. Which of the following is the most likely medication the patient recently started? Let's look at the key features. So we have a rash in the cheeks and nose, we have fatigue and body ache, and we have new medication. All of this is very consistent with drug-induced lupus. There are certain medications like hydralazine and procainamide that can trigger lupus or lupus-like illness in some susceptible patients. If the disease starts, there will be very high levels of ANA and antihistamine antibodies, so we use those to diagnose the patient. ANA is more for screening and more generalized, while antihistamine antibodies are very specific, so they are highly characteristic. The offending medication, of course, must be stopped. And here are the guidelines if you want to look at them. I'll have the link in the description. And if we go back to the question, we know that the patient's symptoms are consistent with lupus and that she recently started a new medication, so she's likely having drug-induced lupus. Hydralazine and procainamide are the most common medications causing this condition, and indeed we do have hydralazine, one of the options. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.